If your focus is on suppressing your Hba1c levels to address diabetes, it is not going to help. Unfortunately, that has been practiced for most of us, and we are actually told to consume less carbs or no carbs, to reduce our Hba1c level. However, your diabetes develops 15 years before your Hba1c spikes. The first stage of diabetes is first your insulin spikes, then your blood sugar spikes, then finally your Hba1c spikes. So Hba1c is the high Hba1c is the last stage of metabolic syndrome, right? And it is not always about consumption of carbohydrates. Obviously we should consume very less sugar, we should not consume ultra processed foods, but even if you're consuming low to moderate carbs, there could be a spike in your blood sugar level, right? And it is not about what you consume, it is about the biochemistry, the cellular biochemistry, right? So let us take an example of white rice. Suppose if you're consuming white rice, or very less amount of white rice, right? When you consume white rice, there is glucose in circulation, right? And pancreas releases insulin. That insulin binds to the insulin receptors, mostly on fat cells, liver cells, and muscle cells. This leads to a signaling cascade, and there's a signal which goes to GLUT4, which is a protein which goes to GLUT4, and GLUT4 tells GLUT4 to go to cell membrane, binds to glucose, clear it from the circulation, and transport inside of cells for storage or energy. This signal is nothing but nitric oxide. So if your body is not producing nitric oxide, even if you're consuming very less carbohydrate, it is going to spike your sugar level, right? So to address the right production of nitric oxide, you should focus on fixing your biology at systemic level. You should improve your oral health, because your oral microbiome, through a pathway produces nitric oxide. Then high level of inflammation and oxidative stress suppresses nitric oxide production. So you have to make sure that you are not eating food which is triggering inflammation, oxidative stress, right? So eat right side of carbohydrates, complex carbohydrates, but also make sure that your biochemistry is functioning well, and you have enough nitric oxide being produced every second.